Staying up on new technology is more important in dentistry now than it's ever been before. And of all the comments I get from my patients, the one that I really value the most is how current our office seems and how well trained and knowledgeable our team is. And so the way that we do that is by staying up on our continuing education. There's obviously a requirement in order to maintain a dentist license of how many hours that an office needs to take each year in continuing education in order to relicense. Our office far exceeds that by hundreds of hours. And so by doing that, we're staying up on all the latest and greatest techniques and learning from the best brains in dentistry today. So I'm going to review a couple of the things that are the most popular in our office, some of the more recent advancements, so that those of you who may be staying away from dentistry can feel comfortable that when you come back, it won't be the experience that you may remember. I always love when patients come in and say something like, my prior dentist was my dentist for 30 years and he was just awesome, but he's retired. I love getting those new patients, but the ones that break my heart, I'm still happy to get them, are the ones who say, I've been away for 30 years because my last experience was so awful. And I know that people, the only thing that they hate going more than going to the dentist is probably public speaking. So this video is part of my mission to help spread the word that dentistry today is so much better than it was. Back in the day, the olden days, and even some of my patients remember this, there wasn't even dental anesthetic. All dentistry was done with the patient not being numb, including pulling teeth. Dental anesthetic and the ability to numb a tooth, or for you Canadians, to freeze a tooth, is a relatively new thing. So even the old way of doing anesthetic was a huge improvement on what we had before. But the old way of doing dental anesthetic is to use a traditional dental syringe, a needle. And I'm going to show you this, but this isn't how we do it anymore, okay? So for you patients who get freaked out, you might want to close your eyes a little bit, but open them back up in just a minute. So the old way of doing anesthetic is to use this needle holder, and the needle itself would add on out here. I didn't want to put that on because I really didn't want to freak some patients out. And when we go to do anesthetic, you would see this right in front of your eyes, and this freaks people out. My husband would just probably be passing out right now if I was waving this around in front of him. So let me show you the new way of numbing. We use a device called the wand, and the wand is amazing. We still use the same juice, so the same anesthetic that would go in here. Most patients still call it Novocaine, but the brands, or not the brand, but the material that we use today is a new generation of Novocaine. So you might hear us referring to it as lidocaine, articaine, marcaine, any of those canes. We still use the same juice, but now it gets loaded into this little device that gets put into a computer right behind the patient. And the actual device that we use to numb is this little thing called the wand. The tip that goes on the end here is teeny, and the device is placed right over the gums. Most patients don't even feel it. And then we use a foot pedal to dose the anesthetic through the gums and can numb the teeth that way. So I ask you, when we're delivering anesthetic, would you rather have this in front of your eyes or this guy in front of your eyes? It's an amazing improvement. And because we can dose really delicately with the computer-aided dosing system using the foot pedal, there's a lot less pain as the anesthetic is going in. The pain comes from the pressure of the tissue expanding. Another spot that discomfort can come from when we're numbing is the temperature difference between the anesthetic that we're using and body temperature. If you think about it, most of the dental anesthetic is stored at room temperature, which in our office, because my assistant likes it cold, is about 69 degrees. Well, the body is at about 98 degrees, and that temperature difference can make that anesthetic going in just feel so sharp and painful. Well, we warm the anesthetic right before its use up to body temperature, and so it makes, between this new device, the wand, and the warmed dental anesthetic, I can't tell you how many times I'll be doing anesthetic and somebody will say, hey, my lip's getting numb, how'd you do that? And I'm like, well, I just numbed you. And they're like, I didn't even know you were doing it. So huge improvements there. The next area that's a big improvement is the way that we detect cavities. Cavities in the grooves of teeth typically have been found in the past using the dental pick, and we push it down into an area that looks suspicious and kind of jiggle it around, and if it's sticky, if we can feel a pullback, then we know there's a cavity there. Now there's a couple problems with that technique. First problem is that the cavity has to become pretty large for the pick to be able to get down in there and feel it. So sometimes we're letting things go farther than we really needed to. And most patients prefer to be very proactive and are very focused on more preventative care these days. The other problem is that when you go and you do a dental pick and assume let's say we find a cavity on a back molar. What did we do as dentists then? We continued our exam, picking that explorer up and going to the next tooth and checking. And on that tip of that explorer, if there was bacteria and a cavity back here, we're picking that bacteria up and we're basically transplanting it right into the next groove. That bacteria is floating around in the saliva, but we don't need to give it a helping hand. So the new way of checking for cavities is to use a laser cavity detector. This laser will shine into the tooth and then measure the reflection back of the laser light. And if there's decay, it will create a disorganized pattern of light reflected back. And we'll be able to detect cavities much, much earlier and do a very small conservative filling that basically cleans out the groove and shellacks it so that there's no bacteria continuing to grow and tunnel within the tooth, burying itself underneath the other parts of the tooth and creating a bigger problem than needs to be there. So that's how we detect cavities. The other new technological advancement that is a huge hit with patients is getting rid of the cardboard dental x-rays. I remember so distinctly going to the dentist and having those x-rays taken where they say bite down and you're like, I don't want to because you know it's going to hurt. It would cut the roof of my mouth and the floor of my mouth. And those x-rays, while they're necessary because we need them to be able to see in between the teeth where cavities can grow, but the new way of doing it is to use a digital x-ray sensor. Now the digital x-ray sensor has a lot of advantages. One is environmental. The x-ray image goes directly into the computer because it's digital. So we don't need to keep in the office the processor and all of the chemicals that go along with it in order to develop the old cardboard x-rays. The other huge advantage of these digital x-rays is that they're instant. So we can see the image right away and on a computer screen right in front of the patient, magnified about 50 times. So if there's a problem, there's a lot of trust built there because the patient can see and is involved in the treatment decisions that need to be made. But the main advantage, the main reason that patients like it, well, there's two. One is this little thing is so much more comfortable. The edges are smooth and rounded. The sensor, of course, it'll have a sterile bag over the top. The sensor goes in the mouth, you bite down. This does not cut the roof of the mouth or the floor of the mouth, even in the tightest squeeze, teeny tiny mouths. But the other reason patients love it is that the radiation exposure is much less with digital x-rays, fractions of what it was with the cardboard x-rays. So I hope that all of these advancements in dentistry will touch somebody in a way that will get a patient maybe who's been staying away to come on in. I also hope that you'll share it with your friends, and if any of them live in the Northwest, then we would be delighted to have them as patients. We're here in Everett, Washington, and that's just north of Seattle, and I hope to be able to see you. Thank you.